first time they go to the gym and think this is the greatest thing I'm going to start in my life, a new exercise regimen, and bam, they can suffer some chest pain or even a heart attack. So it's important to. Right. Now, if you were going to see someone for the first time who says, hey, I'm looking to get started with exercise, do you do a stress test? What tests are you doing? Do you check an EKG, an echocardiogram, blood testing? What would you think of doing?
Well, first I try to ask them, what type of exercise do you plan on doing? You're planning on just hitting the treadmill for half an hour versus trying to run a marathon for the first time. Then I try to assess, what their family history might be. Do they have heart disease in their family? Who may have died from heart disease? And depending how old they are, I'll decide whether I will do some further testing versus just tell them to start light, get back to me if there's any issues or you feel faint at all during your exercise regimen.
Right. So we talk about blood pressure and how we can help with diet, how we can help with exercise. Let's talk about what happens now when someone comes back to you and even by losing weight or starting to jog a bit, their blood pressure is still high. What are the next steps that you would start to take with them?
Then we talk about medications. If they've done all the lifestyle modification, the blood pressure is still high, then we talk about adding agents to their daily regimen. They try to bring the blood pressure down to 120/80.
Okay, so there are many, many drugs out there. Do folks need one medicine? Do they need two? Are there folks that are on multiple medications?
It all depends on how high the blood pressure is when they first present. And also, sometimes ethnicity makes a difference, age makes a difference, and also if they have other problems that they may have, that some medications may not agree with them. Some medications can affect the kidney, can affect heart rate, so if someone is plans on doing a marathon or running, some medications will slow the heart rate down, they may not be the best regimen for them. But some people are just not controlled on one medication, so they may require multiple medications despite weight loss and dietary changes.
Right, and I see patients all the time who are on a number of different blood pressure medicines just to get them down to that magic number of 120/80, because we talked about the consequences: stroke, heart attacks, problems with the blood vessels where they harden and the blood supply to parts of the body could go down. But you're a kidney specialist, so let's transition a little bit from talking about blood pressure to what blood pressure can do to the kidneys. So what are some of the consequences of having high blood pressure on the kidneys?
So high blood pressure affects the small vessels with the kidneys. It's hard to sort of see it, but over time this happens, and that's irreversible. So the goal is to prevent that from happening. Unfortunately, people do have high blood pressure in the United States. Many people, almost half the population, as you mentioned before. And so kidney disease is very common in the US. And many people have it, they don't know they have it because there's nothing you really feel initially. So it is very important that we keep blood pressure as near to normal as possible to prevent kidney disease in the future.
So someone could be at home, urinating normally, their urine looks normal, they feel fine, but if they have undetected changes in their blood pressure, they can have silently kidney disease going on. Is that correct?
It's very common. There's nothing you feel, especially in the early stages. There's no necessarily any rash, there's no back pain, there's no trouble urinating, urine looks clear, they're comfortable. And sometimes you tell them they have kidney disease, they don't believe you.
Right, so someone comes to your office for the first time, you draw some tests. What are these? How do you detect kidney disease? What kind of tests have to be done?
So basic chemistry is what we look at, something called the BUN, something called the creatinine. And those numbers, if they're elevated, imply something else is going on with the kidneys, something that requires some further investigation. And many times it's not the nephrologist that finds this, it's usually the primary care physician, the endocrinologist, or the cardiologist. Physicians who are seeing the patients for other reasons, but the reasons they're seeing that physician, those reasons have impact on the kidney.
Right. In my practice, every now and then I'll send off some blood work in order to do a CAT scan. We check the kidneys first. And I'll call a patient and ask them, are you aware of any kidney disease? Because on the BUN and the creatinine, I found abnormal values. And you're right. Many times patients don't describe any symptoms. They are completely shocked that they have abnormalities in their kidney tests. So once you find an abnormal creatinine or an abnormal BUN, okay, what are the next steps that you take in working up kidney disease? Do they have to go for a biopsy? Do they need a sonogram? What kind of tests are next?
Again, find out what their lifestyles are like. Are they drinking too much? Are they using medications, over-the-counter medications that can cause kidney disease? Is their blood pressure high? Have they had any previous blood tests? So to look to see if this problem has been around for some time or is it new? Are they having trouble urinating, maybe implying some prostate problem? So it becomes a sort of investigation to find out where this started from, and then also investigation to see what part of it is reversible.
So this requires someone see a specialist who is a kidney specialist, because it may be a number
Yes.
of different things causing it. And it could even be medicines, supplements, vitamins. Do you find that people are taking things sometimes that could affect the kidney that aren't prescribed to them?
Yes, these things are not regulated, and yet they can have side effects. They're not necessarily benign products, because some of them do have effects on the body, and they can also interact with other medications. So even when you come to your primary care physician and say, I'm taking all these herbs and substances, sometimes the physician has to look these things up. And most of the time, because it's not well studied, it's hard to say what can hurt you, what won't hurt you. Some things are better known than others. But either way, it's always good to speak to your physician about what you're taking, anything that you're taking, because some medications will interact with these herbs and supplements that you think may be just natural and benign.
Right. The difference between what we find in a health food store or in a supermarket on the shelf that is a quote-unquote natural or herbal product, the difference between this and a medication is that the Food and Drug Administration, the FDA, has rigorously gone through these medications to know how they work, why they work, what their side effects could be, how they interact. And the difference here is that with the supplements, they are not put through this rigorous study.
And some of these herbs and supplements are sometimes the base for some medications that we use.
That's correct.
That's right.
You know, up to 50% of the drugs that are out there that have been produced over the last few decades have come in some way or form from nature, just safely harnessed and used by us.
And tested. Right?
And tested,
Right.
right. But what you want our viewers to know is that they could affect the kidney or interact with the medicines you're giving them. It's important. I tell my patients all the time, please bring me a list of the food supplements that you're taking, the dietary supplements, and your medicines, because we can look them up and try to figure out if there's any potential.
Yeah, simple medication like ibuprofen, taken every day by everyone. And in your practice, I'm sure you see people coming in with ulcers and bleeding from this medication. On my side, it can cause high blood pressure. It can lead to people having swelling, retaining water. So there are a lot of complications just from a simple medication. Not that it's not necessarily it's not safe to take. However, someone has to monitor you when you take them, especially over long periods of time.
So even common medicines that you or I might take, and our viewers for headaches or muscle aches like ibuprofen, can have effects on blood pressure and the kidney. So it's important to discuss that as well.
Right, so a patient coming in for the first time for an evaluation, what are you taking over the counter? And how often are you taking it? Why are you taking it?
So let's move forward. Someone comes in with kidney disease. You try to fix what might be causing the kidney disease, or at least slow it down. What happens as the kidney disease progresses to the point where they don't work anymore? The kidneys are not functioning as they need to. They're in something called end-stage renal disease. Talk to us a little bit about what can be done next.
So the kidneys regulate many things in the body. They're needed for bone health. They're needed to help produce red blood cells to keep you from becoming anemic. They regulate blood pressure, and they basically filter the waste from the body. So when the kidneys fail or don't work properly, these things build up, these other things stop happening. So people can become very anemic, they can lose their appetite, they could have nausea, begin to retain water, and just feel unwell, along with high blood pressure becoming a problem. So at that point, decisions have to be made whether someone's going to go on maybe dialysis, they're going to be a candidate for possibly a kidney transplant, or sometimes some people choose not to do anything and just want to be made comfortable depending on their age and other things that might be going on in their lives.
So explain hemodialysis, dialysis as people hear about it. This is an incredible advancement in modern medicine where, from what I understand, you essentially have a machine that functions as the kidney. Explain to us, in terms that our viewers will understand, because even myself, I don't understand the whole process of this machine. It is so intricate and complex, but explain to us very basically how dialysis works.
Dialysis is actually an amazing system. Before dialysis, if you had advanced kidney disease, you'd basically die. There was nothing else to offer. So with dialysis, it is basically an artificial kidney. It is in no way as good as having your own kidney, but it still allows us to remove the impurities that the kidneys would normally remove. Unfortunately, because it doesn't work as well as a kidney, you have to do it as often as possible. So dialysis is a system where your blood is passed through a filter and then returned to you after having removed some of the impurities that the kidney should have removed. It could also help manage blood pressure by removing excess fluid from your body, and can also manage things like potassium level, sodium level, and also allow you to breathe more comfortably, say if you're someone who retains too much water and the water fills up.
So it helps even remove volume of fluid from the body, just
Yes.
like urination would do for
Right.
the healthy patient.
Yes.
And what about toxins? I've seen patients who don't have kidney disease, but unfortunately take a medicine or too much of a medicine or a chemical. It could also work in that fashion?
So dialysis is given for other reasons as well. So some people take dialysis because of significant heart failure, as you said, removes volume. Other people have ingested poisons that pass through the kidney, but they're of a certain molecular weight that the kidney machine is able to remove those toxins over one or two or several treatments and basically save a patient's life.
So there are certain chemicals, molecular weight meaning the size of them, that we can't get out of our bodies or can't get it out quickly enough that you can save someone's life
Yes.
with this machine. And how does this machine hook up to the body?
So there are several ways. So you can hook it up through a catheter. It's usually placed in a large vein in the body, either the internal jugular vein, the subclavian vein, or a femoral vein, which is in the groin. Sometimes these can be temporary catheters or more permanent catheters. That's not the preferred method. The preferred method is to have something in your arm called a fistula or something called a graft. And the fistula is your own body. It's a vein and artery put together to form a larger vein to allow a needle to be placed in your body to remove the fluid from your body, pass it through the machine, and return to a separate needle in the same arm.
So your blood leaves the body. A catheter, for our viewers, means a type of intravenous line.
Right.
It's a plastic tube that we can put into the vein and into the arteries. So the blood leaves the body, goes into this marvelous machine called a dialysis machine, gets filtered, and then returned to the patient.
Yes.
Incredible. So now you're doing this for patients who have kidney disease where the kidneys stopped working. You're doing this for patients in an emergency where they may have too much fluid in the body, where they took a chemical by accident or overdosed on something that can harm or kill the patient. And so now they go for dialysis. How many times a week, on average, are your patients going for dialysis?
So for hemodialysis, it's 3 times a week. Some people are able to do it at home, and that when you do it at home, you can do it for multiple treatments, up to 6 treatments a week. There's another type of dialysis called peritoneal dialysis. That dialysis uses basically the lining of your belly to become the filter. And a process is used where a catheter is placed in your abdomen and a fluid called a dialysate is flooded into your belly and it comes back out again. And that's done several times a day, and that removes the impurities from your body. That is something that's done every day.
So, and that's done at home by the patient, right? So what if someone is watching today who is on dialysis and wants to go traveling? Are they tied to Brooklyn where they are, where they live, and their dialysis center? Or can people live somewhat normal lives and travel with kidney disease who are on dialysis?
Traveling is possible, but it has to be planned. So there are dialysis units throughout the United States. So someone has to make an arrangement for you to use another dialysis unit in a state that you want to travel. So there has to be a place for you to dialyze. You don't want to miss too many dialysis treatments. This is basically your lifeline. There's possible sometimes to take cruises that have dialysis on board. And there's some countries in the world that do hemodialysis as well. But again, that arrangement has to be made before you go.
So there's a lot of planning that goes into this.
Yes.
Our viewers need to talk to their nephrologist, their dialysis specialist.
Social worker as well to make these arrangements.
And so if someone gets on a cruise ship, they actually have sometimes dialysis machines
Special
on?
cruises do have them.
Amazing.
And
Isn't that incredible?
nephrologists to monitor them as well.
So folks who are suffering from one of the worst diseases we know of, kidney failure, can actually lead somewhat of a normal life.
Still travel, still possible.
But for folks, this isn't comfortable. We know that. And there is something called kidney transplant. Tell us a little bit about that so our viewers understand what kidney transplant is and what it can do for patients.
So kidney transplant is taking either a kidney from a living donor or someone who has passed, a deceased donor, and implanting it in the abdomen to take the place of the kidneys of your kidneys that are not working. You have to meet criteria to get the transplant. It's not for everyone. You have to be a patient that's been compliant with their medication, who has some sort of social support, and of course, you don't have any terribly bad habits. Because this is a gift that you're getting. It takes a lot of effort to maintain the kidney, a lot of medications to maintain the kidney. So you have to be someone who really wants this kidney and will do everything it takes to maintain the kidney.
This is a gift either from somebody who is alive, who decides that they're a match for you and are willing to donate a part of their body. So it is an incredibly special gift.
Yes.
Or sometimes, unfortunately, from someone who passes away who is an organ donor, kidneys can be donated that way. And as you said, even once a kidney is transplanted, it's not cured per se. They still need to be on medications.
Yes.
They still need to take medications so the body doesn't reject.
You still consider it as having kidney disease, and that's a lifelong diagnosis. And these medications that you take, they're every day, and they allow your body to maintain this organ that initially was not yours.
But the goal is, for our viewers today, as we discussed, getting ahead of the disease,
Yes.
seeing a physician before you develop kidney disease, before hypertension is allowed to have its bad side effects. These are silent killers. If someone sees you quickly, early, once a year or however often it is, sees their primary care doctor, they can prevent these terrible consequences. Thank you for joining us today on Medcastplus. We are here to help educate our viewers on different health topics. We thank Dr.Serge Balmir for joining us today. And as we discussed, high blood pressure can be a silent killer. It affects nearly half of all Americans, and left untreated can have serious health consequences. The topics discussed on our show today are for informative and educational purposes only, and it is important that you speak with your physician regarding your own health. For more information or to leave a comment or suggestion, please contact us at medcastplus.com or 718-510-2103. I'm your host, Dr. Jack Braha. Stay healthy, Brooklyn.